All right, Phoenix Children's Hospital continues to lead the way when it comes to treating childhood diseases, cancers specifically.
12 to 13,000 cases of childhood cancers are diagnosed in our country every single year. Clinical trials, new drugs, targeted specific treatment per patient is what contributes to these cure rates.
You got it. Take a look.
Over the last 10 years, the advancements made in fighting childhood diseases, specifically pediatric cancers, have been incredible. PCH has made great strides in this arena through their emerging precision medicine program. Dr. Jessica Backlund, Director of Clinical Oncology Research at PCH, has seen the progress.
So we cure now more than 75% of kids with cancer, and some patients more than 90%.
Last year alone, the clinic diagnosed more than 300 new patients with various types of childhood cancers. Patients like 4-year-old Brooklyn and her best friend 8-year-old Hannah, both diagnosed last May with leukemia and are in the middle of treatments now.
So the treatment for this is 2.5 years, so she'll be done September of 2018. And in that time they include anything from chemo to radiation to steroids, antibiotics, just trying to get rid of all of the leukemia. Well, when she was diagnosed, they kind of gave us like an immediate plan. I was like, okay, here you go. And we were like, wait a second, what do you mean the whole next 2.5 years is planned out? And so we were a little bit concerned, and they have sat with us every single time that we have a question. They are very thorough, they're very honest. They tell you best case scenario, they tell you worst case scenario so that you're prepared from the beginning.
When the patients first come in, a lot of them will start with the same treatment, but as we learn more about their leukemia, what areas are involved, like if they have involvement in their brain or other areas, then the treatment gets changed. We also look at how they respond to treatment in the beginning, and so for leukemia patients, after the first month, we look and see how well they're responding, and depending on that, we decide how intense treatment we need to do after that.
Along with targeted treatment for each specific patient, Dr. Backlund credits clinical trials for much of the cure rate success in pediatric cancers.
Childhood cancer, a lot of ways, is one of the great success stories in medicine. We now cure more than 3/4 of kids with cancer, which was differently, certainly 20 years ago. And every year we're getting better and better. And one of those reasons is the majority of kids enroll in clinical trials. While 2% of adults with cancer enroll in clinical trials, over 50% of kids do. It's actually been shown that children who enroll in clinical trials actually overall do better. And at the same time, we're trying to learn from every child so that each time, after each trial, we just improve things.
15 years ago, there were 37 clinical trials going. Today, they have over 150. That, along with new drugs and agents being tried and used, are adding to the treatment success. As for Brooklyn and Hannah, they will continue treatment in the clinic until they reach maintenance. Their time spent together has created an everlasting bond.
Hannah and Brooklyn were diagnosed a day apart, and they immediately clicked. And they have just become the best of friends. Her mom and I have become really good friends, and it's just when you're having a hard day, nice to talk to someone who can relate.
True supergirls with super strength that they show every single day. Tatum is forever grateful for the care they've been given while embarking on this challenging journey.
It's been great here. They've absolutely taken care of us, and we just love all of her doctors and nurses. We couldn't be in better hands.
Oh, those girls. Their little laughs were infectious that day, and they will both wrap up their treatment. Obviously, the treatment plan for leukemia is about 2.5 years, so 2018 is their year.
Good for them.
And they'll continue even when they get to that maintenance phase. They won't have to go to the clinic anymore, but they still continue to take a chemotherapy pill and treatment ongoing up to that point. So,
and is there any more important work in our world than making sick kids well?
No.
And they do it so well there.
Every day
right?
they do it, yeah.